Thank you, Ms. Sugarman. But I assure you this that we don't have to just lobby our elected officials. We can replace our elected officials.
All
Um,
right.
and
Recall. All
yes,
right.
in our last election, Muriel Bowser had less than 50% support of the city. And that's why we have ranked choice voting, so we can have people that actually reflect us. And as I said earlier, I'm running for Congress myself to challenge our 34-year incumbent with Eleanor Holmes Norton. So we don't have to accept the status quo. We can change it and challenge it. Um, I just want to acknowledge that something that Dr. Chapman was talking about. He said, in terms of, people who have vested interest in maintaining the status quo, they are gatekeepers who are put in place deliberately to make sure nothing fundamentally changes. We need to understand that. And so, no, it's not just by happenstance. This is by design. This is public policy. And something that Ambrose had mentioned earlier, that 80% of our negative health outcomes happen outside of the doctor's office. So I saw a great documentary, and I want to put this on everyone. I'm gonna put it in the chat for everybody, but for our listener audience, it's called "They Are Trying to Kill Us." This is about the food and the poisons in the food, and how they have directly marketed junk food to our communities that contribute to that 80% of negative health outcomes. And what I learned in that film was that there is a direct correlation between people who own fast food companies and also have investments in pharmaceutical companies that are providing medications
Mhm.
that these people become dependent on after those diets take effect. So there is a lot of joogie boogie going on here, and we need to connect the dots on that. And we need to have a level of political maturity to understand that. So I'm welcoming this conversation. I hope that we will continue to scratch beneath the surface and continue to pull back the layers of this onion, and not in woe is me, distraught, and throw our hands up. But I think that we are the ones we've been waiting for. And the greatest power is convincing people they don't have any. And I think everyone here could collectively contribute to some solutions and some outcomes that can challenge this and turn this thing around. But we're going to have to educate the public. We need to come together with a media campaign. We need to put our heads together. So hopefully this is the first of many conversations to move us forward. And I hope that we can take advantage of the time that we have now, the fierce urgency of now.
Absolutely. Transitioning our citizens from victim mode to activist mode. Very well said.
Activism. Let's get Ambrose in here,
yes.
because in our planning discussions for this program, we talked about the fact that, is it just that the city council is being lazy, or there's, some of us who've been here for a while know that there are sometimes things going on that we don't necessarily know about. We know that they were planning to close DC General for a long time before it really became public.
Mhm.
But so we don't exactly know what may or may not be going on around this issue with Unity, but we need to be thinking about it.
Absolutely.
Ambrose?
One of the things that we need to be very vigilant about is how hedge funds buy up healthcare companies. That is extreme. They're not only buying up healthcare companies, they're buying up prisons, and they're changing policies. If you are someone that is assigned to an MCO, a managed care company in DC, they assign you your primary care doctor. Okay, so I was assigned a primary care doctor at Unity. And that's the case for anyone who is signed up with an MCO, a managed care company. They're assigned a primary care physician, and so that like Dr. Chapman said, it is about the money. They want to maintain the money flow by doing a number of different things. One of those things is keeping people sick, even though they profess that they want to keep emergency room visits low, but emergency room visits are how hospitals make their money. And so, as long as if they're talking about uh, keeping the doors open because you get the reimbursement rates, that is healthy for physicians to be able to take care of patients. They need those doors open.
Mhm.
But we talked about the jail earlier, and I just want to say I wanted to make sure that I said this, because I will get to what we need to do as far as the community is concerned as well. But in the DC jail, I'm a proponent of food as medicine. And in the DC jail, The food contract is by Aramark. And if you are a proponent of food as medicine, you got to look at what is happening in DC jails, where 62% of people never or rarely have fresh vegetables, and 55% rarely or never have fresh fruits. 70% reported that the food was either spoiled or rotten. And this doesn't lend to good health either. So to me, it's all a mixture of what is happening in terms of what I think is the genocidal nature of our government, the genocidal nature of our country, in terms of what is happening in all aspects of life, including those that are incarcerated, and including those that are in community, feeding sugar into our communities as far and as wide as they can. And so this whole thing we've got to expose, and we've got to educate our community about this. Access to and the pervasiveness of sugar, which is a food issue, is still a health issue. And so when we talk about educating our people about what's happening with unity, we've got to go into the communities. We've got to go amongst the patients that are unity patients and tell them that the physicians and that the nurses need their support, to call your council person, to call your mayor, and to bring attention to this, to have community forums like this one, have open forums in the community, and let people know exactly what is going on. We did a lot of that work when they were trying to build the new hospital. And we did that. I did that for 2.5 years, trying to build community support for a level 3 trauma center, which they finally did. But it took a lot of advocacy work. It took a lot of going to community meetings and talking about this issue. And that's part of what needs to happen, going into the community, talking about these issues at community meetings. Don't just have forums, but go to the people.
Am I on the air? We have
Yes.
6 minutes left, folks. I want to make sure that people have a chance to give their final word. Dr. Chapman, in 1
Right.
minute, what would you say your final statement is about how do we change this? How do we organize the elected officials and the community to care, to get involved, to do something?
Take to the streets. We have to stay together, support each other, and vote. I think someone said earlier that we can vote these folks out, and that's what's going to happen. We have enemies within. This is not a black or white thing. We have enemies within our community who are just as destructive as Donald Trump.
Yeah.
That's a final
true.
word. That's a
That's
final
true.
word.
I wonder, Roach, what would be your final statement?
We need to take direct action. Take to the streets, as Ms. Sugarman said. Voting them rascals out, yeah, we can vote them out, but right now we need to take to the streets, get the churches, get the community involved. This is a crisis. Folks now don't have medical care. They're already making inadequate wages. They ain't got enough money to live off. Even if they get a prescription, they can't afford to pay for it. I mean, come on. So this is a crisis. We need to take to the streets, have a mass rally in front of the mayor's office. I don't care what it is. People are dying because there's lack of treatment. There's nobody there to provide the services to them. You know what I mean?
This is correct.
Yes, absolutely.
On September the 2nd, the people are doing just that. On Labor Day, they're taking it to the streets, and we're going to provide Joni with that information so that you guys have access to that. We need to do just that, and we need to be strategic. The meeting.
We can go in front of the mayor's office, her house. Let's go in front of a house. This is urgent. This is a crisis.
It sure is.
Absolutely.
The median age for citizens in the district is 34 years of age, which means our millennial population. So we need to be strategic about mobilizing our millennial voices.
Absolutely.
Go ahead. Thank you.
Let's hear Kate Sugarman.
Yeah, and you can go on social media, look at the group Climate Defiance. Disclaimer, it's my son. But it doesn't take a lot of people to make an outsized disruption. And you don't have to get arrested. And, if you call out, like people said, call out the mayor, find out, events that she's going to, or find out where the members of council are going to, and shame them. And it doesn't take a lot of people to make an outside disruption. And if you don't want to make the disruption, then you take it on your video. So you can video another person on your phone. Take your phone, make a video of somebody embarrassing our elected officials. They work for us. And then you post it on social media and you can have an out and shame them because, 80,000 people are going to risk going without health care and shame the people who work for us, our elected officials.
Absolutely.
And they full of jiggy boogie.
Yes, they are. And I would say, Dr. Sugarman, but I also would agree with Roach that we really need the masses of people. And normally,
Direct action. Let's take it to the streets. We got to stop it. We're talking and people are dying.
You need to win it in the court of public opinion. You're absolutely right.
That's right. Oh, we have about 2 minutes left. Kimon, you want to get your last point in again?
Yeah, of course. I'm still here. I'm up here posting on social media as we talking, and I'm getting a lot of text messages, a thumbs up on the content that we are sharing with the public here today. So I'm looking forward to where we go from here. Again, this is Kimon Freeman. That's Freeman, the number 4, Congress.com. Freeman, number 4, Congress.com. And when Dr. Chapman said there's a number of Black people in office who are as much as a detriment to our community as Trump, I think that's gospel. We need to acknowledge that. Just because, we said this before, everybody my skin folk ain't my kinfolk. And we need to understand that this is not about racial politics. They're killing all of us. And we need to understand that this sick care system is cradle to the grave oppression. It starts from the school lunches and the commercials. America is the only country that allows direct to consumer pharmaceutical marketing. They got a drug for everything that you possibly can imagine. And the doctors are not trained to acknowledge the role that food plays. Ambrose brought this up, and nutrition plays and contributes to our sickness. They don't talk about that. And lastly, I was in Cuba this past February, and a lot of people don't know this, but Cuba has medicine that pretty much eliminates diabetic amputations. But America would not allow that treatment to be made available in the States. And I'm quoting from the U.S. ambassador who told me that was to protect U.S. business interests. Therefore, it's in U.S. business interest to keep chopping people's feet off like Kuta Kinte rather than give them the treatment that they need to prevent diabetic amputations. And now we have dialysis centers around here like liquor stores. And so we need to acknowledge that this is an emergency. We have a health crisis when we have over 2 decades disparity between life expectancy on your zip code in the same exact city.
For decades.
Absolutely.
It's
unacceptable.
It's unacceptable. We're getting a lot of texts. You're right. People are saying, awesome platform, great job. I'm saluting everyone on the show.
And let's not forget that the undertone of this is that the violation of DC citizens' human and civil rights are happening as a result of these healthcare disparities as these corporations come forward and make money. We've got to address the civil and human rights violations.
And with that, Rhonda, you got the last word. Thanks to everybody. Thanks to the Union of American Physicians and Dentists. Thanks to Roach. Thanks to Kimon, Ambrose, Dr. Sugarman, all the other providers. Thanks to Carrie Lane, who is the union rep. And thanks to you, the listeners. We're gonna make a difference. We're gonna stick together.
Sure will.
Let's hear the last song by Lucy Murphy and Friends. Thank you, Kalia, very much.
Are turned away. The system won't provide for the ones who cannot pay. Go tell it to the nation on Capitol Hill and everywhere. Go tell it to the nation. We all deserve health care.